Welcome to the deep dive. This is where we take sources you're curious about and really unpack them, get you the key knowledge fast.
Yeah, dig right in.
So today, we're focusing on something really important for one of our listeners, how to maintain well-being, as we get older.
Huge topic.
It is. And they sent us the Integrated Care Handbook.pdf. So our mission today is to pull out the essentials on supporting healthy aging right within our communities.
That was good.
And I've got our expert here to help us navigate it. Okay, let's dive in. The handbook kicks off with aging in place, but then also aging in the right place. What's the difference there? Why does that matter?
Right. So aging in place is basically the idea most people know being able to stay in your own home, your own community, safely, comfortably, even as you get older or your health changes.
Okay, the familiar goal.
Exactly. But aging in the right place, well, it adds a layer. It kind of acknowledges that, as our needs change over time, our current home might not actually be the best fit anymore.
Oh,
It's more about proactively thinking, okay, what environment really supports my needs and preferences now? Maybe that's still home. Maybe it's somewhere with more specific support.
so for our listener, it's thinking bigger than just staying put. It's about what allows you to really thrive.
Precisely. It's about optimizing, not just sticking with the status quo.
That makes a lot of sense. Okay, then the handbook brings up functional ability
Hmm.
based on a big 2015 world report. This feels pretty central.
Oh, absolutely. It's foundational. That report really shifted the conversation about healthy aging. Instead of just diseases, it focuses on building and keeping your functional ability.
And how do they define that?
They define it as the health-related attributes that let people be and do what they actually value in life.
Okay.
So for you listening, it means thinking about what activities, what parts of life are genuinely important to you or your loved ones, and how health efforts can, support those specific things.
Got it. So less about the diagnosis list, more about what you can actually do. And functional ability isn't just one single thing, is it?
No, that's right. It's really a combination. Three key parts. First, your intrinsic capacity. That's basically all your internal physical and mental abilities, muscle strength, memory, sight, hearing, all that.
Okay, your personal toolkit.
Kind of, yeah.
Hmm.
Then there's the environment. That's everything external. Your home, your community, transport, social attitudes, policies.
The whole context.
Exactly.
Hmm.
And crucially, the third part is the interaction between your capacity and your environment.
So, if someone's vision declines, that's intrinsic capacity changing. How much that affects their ability to, say, read or get around their functional ability depends hugely on whether they have good lighting at home or accessible transport nearby.
You've got it. And what's really interesting is that a supportive environment can actually compensate for some losses in that intrinsic capacity. It can help someone stay independent longer.
Right. So, thinking about healthy aging, you need to look at both the person and their surroundings. It's a two-part puzzle.
Absolutely. Both are critical pieces.
And this wider view seems really key. The handbook emphasizes moving beyond just tackling individual diseases in older people. Why is that shift so important?
Well, it's a good point. Healthcare traditionally often looks at each disease separately. Treat the diabetes, treat the hypertension,
Standard practice.
and managing those is still vital, obviously. But if we only do that, we can miss the bigger picture of how someone is actually managing in their everyday life.
Okay.
Things like gradual changes in hearing, vision, memory, mobility. They might not be diseases in the classic sense, but boy, can they impact quality of life and doing what you value.
Right. You could have perfect blood sugar control, but if you can't see well enough to cook safely, that's a huge problem.
So the handbook pushes for this more comprehensive approach, which brings us to integrated care. What does that actually mean in practice?
Okay, integrated care. It's about making health and social care services work together seamlessly, all centered around the person.
So breaking down silos. Exactly. Managing and delivering services. So there's a continuum from health promotion and prevention through diagnosis, treatment, rehab, palliative care, and really importantly, social care, like long-term support.
And this happens across different places.
Yes, across settings, doctor's office, community centers, hospitals, home, and across the life course. It's about connecting all the dots.
So it's not just specialists talking, but also linking health with, say, help getting groceries or adapting the home.
Precisely. And this whole integrated approach is built on some key principles.
Okay, what are those?
Well, first and foremost is empowering older people themselves. They're seen as key actors in their own health. They have the right to understand, make decisions, set their own goals.
Makes sense. Their voice matters most.
Absolutely. Their meaningful engagement and that of their carers is crucial.
Carers, too. That's important. What else?
Another big one is the role of primary care workers, including those out in the community. They're often the first contact. They're vital for spotting early declines in functional ability and giving evidence-based help.
The front lines, so to speak.
You could say that. Then there's the role of community stakeholders.
Who does that include?
Oh, various groups of local charities, volunteer organizations, senior centers, faith groups, neighbors even. They can really help support integrated care, empower self-care, provide support.
So tapping into existing community resources.
Exactly. Raising awareness, advocating, maybe even providing some direct help. And finally, the handbook frames maintaining older people's health not just as a cost, but as an investment in human and social capital. It links it to bigger picture goals, like the UN Sustainable Development Goals.
Right, seeing the value. Okay, these principles paint a picture of a very connected, proactive system. Now, you mentioned a key framework, the ICOP pathway.
Yes, ICOP Integrated Care for Older People. It's basically a practical, step-by-step way to implement this integrated care idea.
So how does it start?
Step 1 is a basic assessment, often done right in the community. Could be by a community health worker, maybe a trained volunteer. The big goal here is early contact, health promotion, prevention, catching things early. Proactive, not just reactive.
Exactly. This first check looks for potential declines in 5 key areas of that intrinsic capacity we talked about. Cognition thinking, memory, locomotor capacity mobility, vitality energy, nutrition, vision, and hearing. And also psychological capacity, so mood.
The core functions.
Right. And alongside that check, they give general health advice, encourage self-care things like getting vaccines, managing heart health risks, and connect people to local community services.
And what if they spot a potential issue in that basic check?
Good question. If something flags up, the pathway involves referring the person to primary care, maybe social services too, for a deeper look.
Okay.
The handbook even mentions a tool, the 5 A's, ask, advise, assess, assist, arrange, to help community workers guide people on lifestyle changes, like for heart health.
Practical tools.
Yeah. And community support might mean advice on social clubs, resources for carers, or even simple things like bladder training tips for incontinence.
Okay, step 1. Community outreach, basic screen, advice, and referral if needed. What's step 2?
Step 2 usually happens at a primary care facility. It's a much more in-depth assessment.
Digging deeper.
Definitely. Taking a full medical history, really understanding the person's values, their priorities, their social situation, who supports them. Healthcare pros use specific validated tools here to properly assess any loss in intrinsic capacity.
Okay.
They also check for related diseases, heart disease, diabetes, etc. Assess risk factors, figure out if assistive products are needed, look at the home environment's safety and accessibility.
And it's not just focused on the older person alone, right? You mentioned carers earlier.
Absolutely. Step 2 explicitly includes looking at the needs of family and other carers.
Yeah.
Assessing their well-being, risk of burnout, need for respite, that's crucial.
That support system is vital.
It really is. So after this deep dive assessment, the next stage in ICOP is really important.
Yeah.
Collaborative goal setting.
How does that work?
It's a partnership. The older person and the health worker sit down together and figure out what goals matter most to the individual for their health and their life.
So person-centered.
Totally. They agree on short-term goals, maybe for the next 3 months, and longer-term ones, like 6 to 12 months out. The key is prioritizing and agreeing together.
Tailored goals. What comes after setting them?
Agreeing on the interventions, based on informed consent, of course, and directly linked to those goals, needs, and preferences.
Makes sense.
This could involve self-care strategies, environmental tweaks, caregiver support, and the health provider needs good knowledge of what services are actually available, health and social care, to make good suggestions.
Right, knowing the local resources.
Yes, and often it's not just one professional. You might have a multidisciplinary team. In that case, having a case manager or a care coordinator is really helpful to keep everything aligned.
Yeah, to quarterback the whole thing. Sounds like it could get complicated.
It can be, which makes that coordination role vital. The final piece of the ICOP pathway is implementing the plan and then monitoring it.
So follow through.
Exactly.
Yeah.
Regular follow-up could be in person, phone, video call, checking if the plan's working, any side effects, reassessing how things are going, summarizing outcomes, and crucially, being ready to adapt to the plan if needed.
It's a continuous loop then. Assessment, action, checking, adjusting.
That's the idea, a dynamic process.
Okay. Now, going back to that community contact in step 1, and just generally for healthy aging, The handbook really emphasizes promoting healthy lifestyles. What are the main takeaways there for our listener?
Yeah, there's a lot of practical advice. Physical activity is huge. The message is basically any movement helps. The guideline is aiming for about 150 minutes of moderate activity or 75 minutes of vigorous activity per week, or, some mix.
Get moving. What about diet?
Balanced diet, high in fiber, staying hydrated is also key, aiming for maybe 6 to 8 cups of fluids daily.
Yeah.
Good oral health brushing twice a day. And really importantly, staying socially connected, taking part in community life. That's highlighted for overall well-being.
The fundamentals. Anything else particularly for older adults?
Yes. Keeping up with vaccinations is recommended, based on local guidelines, of course.
Look.
Looking after mental health, reducing stress, doing enjoyable things. Good sleep is important.
Makes sense.
And keeping the brain active. Cognitive stimulation.
Yeah.
Also taking care of vision and hearing, regular checkups, protecting eyes from UV, seeking advice if hearing changes.
It's really comprehensive, physical, mental, social. Now, the handbook also gets specific about addressing declines in those intrinsic capacity areas. Can you give us a quick flavor of those care pathways?
Sure. For each of those areas, cognition, mobility, nutrition, vision, hearing, and also mood, it outlines specific ways to assess and intervene.
Okay, like for cognitive issues.
For cognitive decline, the basic check might involve simple memory or orientation questions. Interventions focus on things like cognitive stimulation exercises, using memory aids, and really crucial, supporting the caregivers.
Right, and mobility.
Basic assessment might be a simple chair rise test. Management involves tailored exercise programs, working on fall prevention like home mods, checking footwear, and managing any pain.
Okay. How about nutrition and senses?
Undernutrition check might ask about recent unintentional weight loss. Advice centers on enough protein, fluids, oral health, and maybe encouraging social meals.
Good tips. Vision and hearing.
Vision screening uses basic near and distance tests. Management involves tackling risk factors like diabetes or hypertension, regular eye exams, and optimizing the home environment, better lighting, contrast. For hearing, a whisper test might be the first step. Interventions include communication strategies, tackling hearing aid stigma, maybe home adaptations like visual alerts for doorbells.
And mood.
Basic questions look for loss of interest or feeling down. Advice focuses on reducing stress, building social support, relaxation techniques. Psychoeducation could be part of it too.
It sounds very structured for identifying and managing these common issues early. The handbook also mentions assistive products quite a bit. What are those exactly?
Yeah, assistive products are basically any tool or device that helps someone maintain or improve their function and independence, and ultimately, their well-being.
Can you give some examples?
Sure, it's a huge range. Mobility aids like wheelchairs, walkers, canes, vision aid spectacles, magnifiers, hearing aids, pill organizers to manage medications, even things like fall alarms or adapted cutlery.
So things that bridge the gap caused by a limitation.
Exactly. They help people overcome challenges and participate more fully.
And how should they be provided? It's not just handing something over, is it?
No, definitely not. The handbook stresses a process. First, a proper assessment of the person's specific need. Second, fitting the device correctly. Third, training, making sure the person and their carers know how to use and maintain it safely. And fourth, ongoing monitoring and support to make sure it's still working for them.
Right, ensuring it's actually used effectively. Communication is another theme that comes up talking with older people. Key points there.
Respect is number one. Using the right form of address, actively listening, making sure the environment is suitable, private, accessible. Adapting how you communicate if someone has hearing or vision loss, speaking clearly, good lighting. And basically, avoiding ageist assumptions. Treat everyone with dignity.
Absolutely fundamental. And related to that respect is the idea of self-care and self-management. How does the handbook see empowering older people here?
It's about giving older people, and their carers too, the information, the skills, the tools they need to be active partners in their own health. Managing conditions, promoting health, maintaining function.
So moving away from a purely doctor knows best model.
Yeah, much more towards partnership and supporting their autonomy, helping them make informed choices about their health and lifestyle.
Okay, nearly there. The handbook also talks about engaging community stakeholders and the practical side of implementing all this. Why are those bits so important?
Well, engaging those community stakeholders, the local groups, volunteers, community health workers we mentioned is key because they have the local knowledge, the trust. They can raise awareness, advocate for needs, help keep services accountable, maybe even provide some direct support if they're properly trained and supervised.
Boots on the ground.
Kind of, yeah. And for implementation, the handbook makes it clear. You have to adapt these pathways to the local reality. What resources are available? What's the workforce capacity? What's the infrastructure like? Even thinking about digital tech, its potential, but also the challenges, like digital literacy or access.
So no one-size-fits-all solution. It has to be tailored.
Exactly. It needs to be rooted in the community it serves.
Well, this has been a really comprehensive deep dive into the Integrated Care Handbook. It's crystal clear that supporting healthy aging is much bigger than just treating diseases.
Absolutely. It's about this holistic, integrated approach, focusing on functional ability, what the person actually needs and wants.
And doing that within their community context. I think what's really valuable, especially for our listener, is that shift in focus, enabling quality of life, independence, not just managing illness.
Yes, this framework offers a really practical way to think about how we can support people to age well.
And it's clear it takes a village, so to speak, not just doctors, but the whole community. So thinking about all these pieces in treatment capacity, environment, integrated care, community support, here's a final thought for you listening. What's one small practical change that could perhaps be made in your own local community to better support the well-being and independence of older adults? Definitely food for thought.
A great question to ponder.
We really encourage you to check out the Integrated Care Handbook if you want to explore this further. Thanks for taking this deep dive with us today.